Scientists are warning that new variants of COVID will continue to emerge, and every fresh infection is an opportunity for another mutation. Health officials in the UK are forging ahead with efforts to keep ahead of the virus, both in the labs and on the street.
Back that way, or we can go from this way.
They're tracking down a shape-shifting virus, a mutated version that evades the immune system. And to stop it spreading, they're pounding the streets.
I'm with Merton Council. We're handing out COVID tests. Yep.
Blanket testing a whole community.
In a way, it kind of is square one, you know, testing again and, you know, a new variant. But, you know, the quicker, I think we all want it out of the way as quick as possible, don't we?
More than 100,000 people in a dozen or so areas of the country are being surge tested. In Merton, South London, it's the South African variant causing concern. But homegrown virus is mutating too. The Garden of England, the crucible of coronavirus B117, the Kent variant. Patient 0, the incubator of the virus, has never been found. But the archive of virus samples shows there was a case in Kent on the 20th of September. Another in London the next day. But they were only detected later.
The outbreak only came to light several weeks later in the Medway towns of Chatham and Rochester. During the November lockdown, cases were still surging while they were falling elsewhere in the country. Scientists got curious, did the tests, and only then found they were dealing with a new, more transmissible variant.
Data analysis by Sky News shows cases likely to be caused by the highly infectious variant spread rapidly across Kent during December into the eastern side of London, then countrywide. Its mutations giving it the edge over the original virus until the January lockdown slammed on the brakes. In Cambridge, there are clues to how the variants evolve. Scientists treated a man with a COVID infection he couldn't shake off. After every new treatment, the virus completely changed.
Within 7 days, the virus had completely shifted its genetic makeup. Billions and billions of particles had shifted.
Could this have been how the Kent outbreak started?
First sequences are from September. And again, that fits very nicely with infection during the first wave in April, giving the virus a few months to evolve and mutate and then spill out into the community once it had acquired enough mutations to make it highly transmissible.
For geneticists, it's a warning. As more people become immune through infection or vaccination, the virus has to mutate to survive. Lifting lockdown before daily cases are in the low thousands would be a risk, says this expert.
To give, public health, including the genome sequencing that we're doing here, a chance to work out where the virus is mutating, where new variants are starting to spread. We really need that headroom of getting cases down before we can really take our foot off the brake.
Back in Merton, that worries Louise. She's been shielding since March. Her only company has been toffee.
They can change the vaccine slightly, but how many more variants are going to come in while they're changing that one? And if we don't stamp it out now, it's just going to spread like wildfire.
And that's the urgency for the virus hunters.